Good morning and welcome in to For Your Health, a presentation of Medica Pharmacy. And we say, go Tigers.
That is right.
As we are broadcasting this live at several hours before tip-off, and when people see a replay of it now, it will be, the game will be rolling along. We'll get 2 replays of this one in because we know that there may be some people that will be watching the game tonight. Oh, actually, this will come on after the game tonight on BRTV.
Oh, okay.
Because BRTV will actually have the broadcast of the game on cable. So
Excellent.
You'll be on after the game tonight.
All right.
All right. Alyson, good morning and welcome in.
Good morning. Good morning. And good luck, you Bardstown Tigers. Go out there and get them tonight.
That's right. Go Tigers. This is the month of March. This is Colon Cancer Awareness Month.
It is. Colon cancer is one of those kind of diseases that doesn't always give you a symptom before you have a huge problem. And so, a lot of times we talk about diseases, and I'll go through a list of symptoms, and then I'm going to talk about prevention. But since this one, sometimes you don't have any symptoms, I'm actually going to talk about some facts and prevention first. And then we'll go through some symptoms. If you do have them, maybe you'll have at the end of it. So they're expecting in this year, 2014, that we're going to have 96,830 new cases of colon cancer and 40,000 new cases of rectal cancer this year. And they're expected that out of those cases, a little over 50,000 people are going to die from it. So that's a little scary. That's, seems like that's about 40% or so if I were going to do the math in my head. So it's important to know kind of what makes the colon healthy. And the health of your colon is largely determined by the food you eat. And we talk about this all the time, Roth, about that we eat way too many sugars in our American diet, way too many carbohydrate-rich foods, and those cause inflammatory issues in the colon and the intestinal tract that kill off your good bacteria and really wreak a lot of havoc. The other thing is gluten and wheat products, even people that don't test sensitive for it, it can still cause a lot of damage. And in some cases, people don't tolerate dairy. So, gluten, wheat, dairy, those are things you might want to avoid. Especially if you've had a family history, although the vast majority we'll see of colon rectal cancer has no family history of it. So it's also important to know that you need to make sure you're properly eliminating any waste that's left over from the food that you eat. So you need to be having a good bowel movement at minimum once a day, no more than twice a day. So every 12 to 24 hours you should have a bowel movement. If you're not eliminating those toxic particles and they're sitting in your colon causing damage. So if you're not having a good bowel movement, and laxatives are not the answer, usually that means, we've talked before, it means you're magnesium deficient, but you want to make sure you have a good bowel movement every day.
So it's intake and outtake.
That's right. What goes in must go out at a reasonable time frame. I have people that say, I have no problem going to the bathroom. I go 3, 4, 5 times a day. Well, that's too many. Okay. So then you're not absorbing the nutrients you need to absorb for your body to be healthy. So 1 or 2 a day is ideal. Anything more than 2 is too much. Anything less than 1 is definitely not enough. So that's the goal. So we're going to talk about preventing of colon cancer. There's been a lot of research lately that showed that the bacteria that live in your intestines can prevent or cause colon cancer. So we talk all the time, the body's made to be in balance. So you got to have good balance. So you have about 800 different strains at minimum of different bacteria in your intestines.
You said 800?
800 different strains. And 400 of those have been shown that they're the ones that control the bad bacteria or yeast that live in your intestines. And we've talked about yeast before. People that have chronic issues with craving sugars or breads or maybe sometimes alcohol, or they don't think straight, they have trouble with memory and fatigue, might have yeast overgrowth in their intestines. So there is a quiz that'll tell you if you're at risk for having yeast overgrowth. It's 2 pages. It'll take you 10 or 15 minutes to fill it out, and depending on your score, you might have an intestinal yeast issue that would need to be addressed.
Where do you get that quiz?
We actually have that at Medica. I keep it in my Google Drive, so I can email it to people from my phone or my computer or print it out for you. But we have quite a few people that'll stop by just to get that quiz. Okay. So, if you have that sugar cravings, fatigue, foggy thinking, or are just curious, do I score high on that yeast questionnaire, just stop in and get it. I'll show you how to fill it out, and then you total it up, and the scores will tell you, are you likely to have that problem or not. So real quick, easy, and you can do testing for bacteria in the gut. And so since we're talking about bacteria keeping you healthy, we're real excited. A lot of people know we do saliva testing for hormones. We actually have just signed up with a new lab that we can do some saliva testing We can also do digestive functioning testings. So a lot of times that's through stool samples, and some people may not think that's what they want to do, but it actually can test these different bacteria, and it will tell you if you have an imbalance of good versus bad bacteria, if you have a positive yeast culture. So, you know, you can, if you have tried different things and you can't quite figure out what's going on with your digestive tract, this is a pretty interesting, very extensive testing that'll tell you exactly what the imbalance is in your digestive tract so you can figure out how to correct it. So we just signed up, so we don't have those tests yet, but we hope to be getting them here within the next 3 or 4 weeks. So that's something that we're going to be offering here soon. So
it'll take stuff. It'll measure some of those bacteria?
Yeah, they analyze your stool sample, and it'll test you for all kinds of different allergens, but it'll measure the various bacteria that have been linked to certain diseases and problems. And also measure if your good bacteria is out of balance. So it's very extensive, and I know you get like a 4 or 5 page report, and I can see it in my head, but I can't remember from when we learned about it a couple weeks ago exactly everything it tests for. So I just am getting that information in. So and when we get it in, we'll discuss it more so we can let people know what we have to do that there. So and colon cancer is not the only thing linked to bad bacteria in your gut. So you have to have, there are certain bacteria that cause inflammation. One of them is called Fusobacterium. Again, if you don't test for it, you don't know what it is. But there are bad bacteria that cause really bad inflammation in your intestinal tract, and those inflammation-causing bacteria can fuel colon cancer. So that's why it's so important that you kind of know what's going on in that intestinal tract. So there's even some studies that take a very healthy and that, you know, we always study the poor mice, God love them. But you have a healthy mouse with really good intestinal bacteria, and they have actually shown that if you take just a very small sampling of bad bacteria, cancer-causing bacteria, out of one mouse and put it into the healthy mouse, that it very aggressively will turn to colon cancer. So just kind of another proof that you've got to look at the bacterial, what's going on in your gut. So I know people have heard me talk about probiotics before. And we talk about probiotics for diarrhea. We talk about them for sometimes constipation. But with the way Americans like to eat and drink, everybody should be on a probiotic. And here's the keys. You can go anywhere and get a probiotic. You can get some cheap one. You can get whatever. You got to get a good one. You can get digestive enzymes that have a probiotic in it. I don't recommend those. Your probiotic has to live through your stomach and get into your intestines so it can colonize your intestinal tract. So if you pair it with a digestive enzyme, which typically has enzymes and acid to digest your food, it's a really good chance it's going to degrade that good bacteria before it ever leaves your stomach. So you want to get a probiotic by itself. Okay, you need to make sure it has a minimum 6 different strains in it, and you need to make sure that it is guaranteed to deliver whatever amount you're getting. If you're getting a 1 billion capsule, you want to make sure that it's designed to deliver 1 billion. So most of these that are 1 billion really have more, but they're designed to guarantee that you would get minimum 1 billion. But you can get from a 1 billion all the way up to a 100 billion capsule. So everybody's different, so you need to kind of make sure you're getting the right probiotic. They're not all created equal, so just don't go buy some cheap $5 probiotic and expect that you're being protected from any illness or colon cancer. You want to make sure that you get a really, really good one. Again, that's something we can help you with at Medica. We have
that's in the billions.
Yes, exactly. 1 billion is your minimum that you want to take. And I mean, even for kids, I mean, I have my little one. He's been on since he was 2.5, a 1 billion unit probiotic. And I do like to brag that he's only been sick and needed anything really twice in his 7.5 years. So I do say multivitamins and probiotics are helping to keep him healthy. So the other thing is that there's been a link to vitamin D deficiency. And, of course, we're seeing more and more vitamin D deficiency across the board. So people with colorectal cancer tend to have lower levels of vitamin D. And we all slather ourselves with sunscreens. The other thing is we have been preached to for years to eat a low-fat diet. And when you're eating a low-fat diet, you can't absorb your vitamin D. The other thing is a lot of people that have digestive issues and maybe have diarrhea are given a drug called cholesterol, which helps to stop the diarrhea. It also blocks your absorption of every fat-soluble vitamin, so you are much more likely to have low vitamin D levels if you're on certain medications. Statins for cholesterol will lower your vitamin D. The cholesterol will lower your vitamin D. So the vast majority of Americans need a vitamin D. And I will tell you that if you're prescribed that big 50,000 unit of vitamin D, it's amazing to me how many people don't ever get their levels up with that one. And it's really because you have to convert it to active form of vitamin D. So in all honesty, you are better to buy an over-the-counter D3 product. If you're one of those people, especially if you're elderly or on medications and you don't get good vitamin D every day from the sun, then you need to be on 5 to 10,000 units a day, probably for a little while. And then when your levels are up above 100, then you can go down to a couple thousand units a day.
How do you know and find out what your level is?
It's an easy test. So you can get it. A lot of doctors order it on normal blood test. You can also get vitamin D, just like we do saliva testing. We do a finger stick blood drop. I'm wanting to say it's, if you don't have insurance and you don't want to go to the lab and pay a few $100s for full sets of lab, I think, and don't quote me, but please call me at the pharmacy if you want to know the exact price. I think to do the blood drop vitamin D test is around $65, and that does seem like a lot. I think there's some other labs you can incorporate it. So, but if you have no insurance and you want a cheap, easy way, but if you're not sure, I mean, honestly, a couple thousand units of vitamin D isn't going to hurt anyone, and then we can just kind of go off what symptoms you have to maybe you need a 5 or 10,000 unit. So, but a couple thousand units definitely won't hurt anyone to take.
And sun is
sun is the key. It is, and you know when
careful.
Yeah, you got to obviously be careful of the skin cancer risks, and you know the sun does age you. The difference between using the sun to get vitamin D and taking a vitamin D is when you're in the sun, your body will make exactly enough vitamin D that you need. When you take a vitamin D supplement, maybe you're taking too much, so your body can't regulate it when you take it from an external source. So, but anyway, vitamin D is necessary. The last thing that can help prevent, and by no means is this is going to prevent colon cancer if you do it, but it's something that can help, is to use butter in your food. So butyric acid has been shown to prevent colon cancer, and the highest concentrations of butyric acid are in real butter. So, and everybody knows me knows I cannot stand margarines. They are so bad for you. So I just beg and plead people every day, please don't buy margarine. Please don't buy processed butter tasting spreads. The whole I can't believe it's not butter, the blue bonnets, the country crocks. Throw them away and buy the one that is real butter. The one that you flip on the back and it's, milk and salt are your ingredients.
But we were told, for our health, we should maybe lower our intake of butter. If you're saying for our health, we should
eat butter.
Eat butter.
You could, and actually, it's
and
very.
I love butter.
It's a very interesting fact. Is there, for years they said saturated fat is bad, and we went all this low fat, and then all of a sudden, low fat diet made us all very overweight because we're eating nothing but sugar. Well, amazing to me. Now they're saying, oh, you should eat your eggs, you should eat your bacon, you should eat your butter. And saturated fats, by the way, are not linked to heart disease. So a couple of new releases on that. So, and I use myself as an example. I said, I'll give you my cholesterol results anytime you want, and they are about picture perfect. And I could go through a dozen eggs and lots of bacon every week just by myself. So though, sugar is what raises that cholesterol, and then the high insulin levels to fight sugar clogs your arteries up. So don't be afraid to use real butter because margarine is plastic and it causes inflammation. So get rid of those buttery tasting spreads and just buy butter.
Plastic.
That's right. It's one molecule away from plastic. So I'm really not sure why we ever thought that was a good idea.
So if they mess up in the factory, the bucket it's in would be exactly what the stuff is that's inside the bucket.
It's exactly right. And people tell me, well, I don't like to use butter because it's so hard. I'm like, you leave it on the counter. I mean, if you walk in my house, my butter is sitting behind my stove on the counter. And it turns rancid. No, margarine will turn rancid. Butter is perfectly fine for a week, 2 weeks, sitting at room temperature, and then it spreads quite nicely when it's at room temperature. So, yeah, just get butter. It tastes so much better than margarine. So, because I had a lot of margarine in my life too, but I switched to butter in, I think, college, and I've never looked back. So it's great stuff. So just now we're going to go signs and symptoms of colon cancer. And I mentioned a lot of people have no signs or symptoms. You go into your colonoscopy that's recommended when you get older, and voila, you have an issue. So hopefully you do have symptoms so you can nip it in the bud, but this is why that preventative screening, whether you think you're at risk or not, to get those colonoscopies. I mean, nobody likes the thought of a colonoscopy. But, you're sedated. The worst part of it is drinking all the stuff or taking all the pills you have to take to clean you out. That's really the worst part of the whole thing.
And it really wasn't that bad. I was behind on mine. I'll fess up, as we say in Kentucky. But it really wasn't bad. I had just as much fun talking about it and joking about it. To counteract any negatives, really.
Exactly. And, the thing is it may not be a fun screening, but my goodness, if it saves your life, then doing it once a year. Yeah. It's well worth it. So please make sure you're getting screened. If you've had a family history of colon cancer, you definitely need to start that screening process earlier. But, I always recommend anybody that has some kind of weird symptom, whether you think you have a little bit of bleeding, and sometimes bleeding is has nothing to do with colon cancer. You could have just some irritable bowel symptoms, and you can have maybe some hemorrhoids. But if you're having issues, please get it checked out. So you have two different sides of your colon, and they're different sizes. So right-sided colon cancers a lot of times will cause iron deficiency. So sometimes that's a mild symptom that if you can't keep your iron levels up, you're typically, there's one of two reasons. You're either losing blood from somewhere, or you're not able to properly absorb iron from the food you eat, and so you stay in a low iron state. But that's, something to check out. Why are you low iron? Don't just get on an iron supplement. Make sure somebody finds out why you are low in iron to begin with. So get that colon checked out. So, of course, with iron anemia, we tend to be more tired. You also tend to be weak, short of breath. And magnesium is the number one cause of restless legs, but if your iron is low enough, it can actually cause a little bit of restless leg syndrome too. So, make sure you're getting the source of why you're low in iron checked out. The left side of your colon is more narrow, so typically you get more obstructions in that side if you have cancerous growths in there. So you have a bowel obstruction, and some people have had it that aren't colon cancer. It can be quite painful. Typically you get constipated. Then, of course, your body fights that. Next thing you know, then you go back and forth from constipation to diarrhea, but you can get bloating and pain and cramps that indicate that there's some kind of blockage. The other thing is the bright red blood. Might be as simple as hemorrhoids, but it might be that you have a blockage low, and so as stuff goes through that blockage, it irritates and causes bleeding. And then as you go farther down the road and you have a more advanced one, you might have changes in your stool, whether it be color. You might go to the bathroom more frequently. Maybe you go less frequently. Again, bleeding. It's important to know that blood in your stool might be bright red. It also could be dark and tarry. Now, dark and tarry usually is higher up your intestinal line, so it could be from your stomach, from an ulcer, or your small intestines. But dark and tarry or bright red, both of those are signs of blood, so make sure you're getting that checked out. You also, again, abdominal pain, bloating, nausea, or unexplained weight loss. So all of those are signs. So the problem with colon cancer is once you're getting symptomatic, you may be fairly far along in the stages, and so you want to make sure that you're getting that checked out on a regular basis and screened so you can catch it early as opposed to later. Because if you get bad enough colon cancer, your colon, the way it works is you're so attached to everything, you're really likely to get a liver metastases because you're just so close to the liver. And then if it gets into the bloodstream, then obviously it can go anywhere at once. So screening and prevention, as with any disease, is the key.
And again, during this month, it's a good time, just like they say, when you have a change of the daylight savings time to regular time, that's time to check your smoke detectors, change batteries. During colon cancer awareness month is an opportunity for people to say, hey, it's time for me to do that. I hit 50, I believe. Is that the age?
Yeah, it is, unless you have family history, yes.
Unless you have family history, then I think they say 40.
40.
And so get that done, and then keep a lookout. As you pointed out, not a lot of symptoms, but there are a few of them out there, and keep an eye out for those. Because some of those symptoms are things you want to get checked out immediately.
Oh, absolutely. And we do a lot of digestive help, with supplements at the pharmacy. So if you're having some issues and you're not sure, a few questions will tell you is it may be a stomach digestive issue, or maybe you need a probiotic. And I almost always tell people, listen, if we can't correct your digestive issues in a 2-week to 30-day time frame and make it better, then it's definitely something you need to go to get checked out further. And maybe you want to check it out anyway. But a lot of this, constipation to diarrhea and irritable bowel is really a poor digestion and a lack of good intestinal flora, not colon cancer. So don't freak out if you're having a little bit of spastic colon. It may be just very simple. Let's work on your diet and correct the issues. But at the same rate, if you can't correct it in a very short time frame, it's definitely worth getting that colonoscopy and just making sure there's nothing there.
Okay. Again, remind everybody you have a yeast test.
A questionnaire.
Questionnaire.
Yep. Cool. It's very painless. It's not invasive. You don't have to drink any stuff to take the test. And obviously not, to prevent colon cancer. But, bad yeast is a sign that there is an imbalance that we need to correct. So it's just a real quick, simple test. I know we talked about it once before. I had quite a few people come in and take that quiz. So definitely stop in. And then we actually have a couple new things that we just got into Medica. So for those of you, especially with kids, and we're still in that cough and cold season, and now we're starting to rotate into allergy season. And so amazingly, probiotics can make huge improvements in your allergy, you or your children. And I'm a big promoter of newborn babies should be on probiotics to make sure that they don't get the reflux and the colic. But we have a couple of things. If you get a little snotty-nosed baby, we all know it's really tough to get those little bulb things just don't work very well. So there's actually something. It actually has an official name, but everybody calls it the snot sucker.
Mm-hmm.
And so it looks gross, but I'm gonna tell you, it works.
It does.
It works great.
Use it.
Yep.
On grandkids.
Exactly. So it's a little tube that you put in. It has a little filter, so don't worry, you're not going to get anything in your mouth. But you put one into your mouth and you put the other end of those and you suck, and it will pull that snot out of that kid's nose like nothing you've ever seen, and you will be thinking it's the greatest invention ever. So we carry those at the pharmacy now.
I think our kids picked one up in Lexington, and we were sitting, and so I enjoyed watching Lisa do it because I'm afraid I would not do the instructions right, and But anyway, it was fun to watch.
Yeah,
I had to help out. The kids don't like it all that much.
Well, they don't like the little bulby things either.
They don't like the bulb thing either.
And the thing about the bulbs is you have to keep using it. And with this little snot sucker, it gets stuff out of there pretty quickly. And it's actually called a nose Frida, is its perfect technical name. They also, the same company has something called a Wendy. Now, this is actually to help gassy, colicky babies. And I look at it and think, man, I'm not sure any baby's going to like it. But if you have a baby that seems to be gassy and a little bit blocked up, it's basically got this little bitty end to it that you would insert into your baby's rectum, and it's got a wide ending to help them release any gas pressure that they may have in their intestines. So 2 products there. We also have, I think people, if they went and looked, might be amazed at how unsafe Johnson & Johnson's baby products rate. Baby Magic, not a whole lot better. So there's a lot of baby products out there that people have been using for years. And if you go to the Skin Deep website, which is a website where all cosmeceuticals can list their ingredients and they'll rate them. Are they a cancer risk? Are they a hormone disruptor risk? Or what kind of risk they have? 0 is the safest and 10 is the worst. And Johnson & Johnson, most of their baby lotions score an 8 out of 10. That's scary to me, to thinking that if 10's the worst and we're putting stuff on our babies that are 8s, then there's no wonder why we have our pediatric office saying don't use this lavender lotion because it can cause estrogen growth and whatever, because the Johnson & Johnson lavender lotion does do that. But it's not the lavender, it's the lotion. And so we have a new line called Earth Mama Angel Baby. And if you search on the Skin Deep website, almost all of their stuff gets a 0, a 1 at the worst. And so there's not only stuff for babies, there's stuff for moms. So if you're a breastfeeding mom, there's a great nipple cream that you can use to soothe your nipples if they're sore. There is some stretch oil that smells amazing. It's very light scented, so if you are a little bit queasy, it will not. I can't imagine that it would affect, because I'm very sensitive to smells, and I think it smells wonderful, but so light, I don't think you'd ever notice it if you have trouble with morning sickness. We have some new homeopathic stuff for morning sickness that I can tell you from experience is the greatest stuff ever. And then we have a new line of supplements that are designed to replenish the nutrients depleted by prescription. So instead of having to take maybe 3 or 4 different, a CoQ10, a vitamin D, a B12, they're all into one package, and they're very affordable. They're about $13 a month, and they come in a 2-month supply. So having great luck with those. And then we have a new product line, and this is something I'm still learning about, that help you remove toxins from your body. And so they're
Not
little
the thing you put on the bottom of your feet. Huh?
Right. No, these are they're oral drops, capsules, and a throat spray. And one of the throat sprays, the doctor that was teaching us about them in Atlanta says it is amazing for strep throat. Ooh. And so she says just a little throat spray that you spray in the back of your child's mouth. It tastes fine, and then you just massage the lymph glands in the back of their throat where they get swollen. And she says it does an amazing job of strep throat, way better than any antibiotic. My child had strep throat. He still has swollen glands from a year ago, so he's going to be my guinea pig. So give me a couple weeks, I'll let you know how it works. So, but those are the new things. So quite a few new things coming in, and some of them we're pretty excited about.
Great. All right. That's Medica Pharmacy, two locations, and, of course, we support all of our schools, all of our entities here, but today it's Go Tigers.
Today it is Purple and Gold Day, guys, so Go Tigers.
All right. Alyson, thank you so much for coming in. Remember, everybody, Colon Cancer Awareness Month is the month of March, but when you turn 50, guys and gals, let's take a look. And if you have a history of it in your family, when I think they tell us 40.
40, that's right.
So don't wait on March to come around next year. Get that done, and don't do as somebody I know and wait a little too long.
I won't say any names. Well, and if you have any symptoms, even if you're only 20, if you're having symptoms, go get it checked out.
Yeah.
So.
And the snot sucker is a cool thing.
It really is. You might be really thankful in the middle of the night at 2 a.m. when you have a child that can't breathe that you can get the snot right out of their nose and get them back to bed in a timely fashion.
Because you feel so bad. Because we have some of our grandkids stay quite a bit with us, and you feel so sorry for them because it's not fun being an adult with that. But when it's a small child, you can't teach it. Tell a 1-year-old now, blow your nose.
Well, and as a mom, I think all other moms and dads can relate, it is way more stressful on the parent for that child to be all stuffed up and you not be able to do anything. I mean, the kid's upset, obviously, and fussy, but I think we're way more upset than that baby.
We are.
So, yeah.
All right, well, Alyson, thank you very much. That's For Your Health, a presentation of Medica Pharmacy here in Bardstown, just up the street,
corner of 4th and Stephen Foster.
And up in Shepherdsville, Kentucky. That's our show for today. Have a great day from WBRT and BRTV.